Thank you. Now I would like to call G. Vaishnavi from third year.
అన్ని చెడు ఇదే ఉన్నారండి ఫైనల్ ఇయర్ నుంచి ఒకరేనా
Yes, active participant.
సెలెక్ట్ చేస్తాను అది ఏంటి చేస్తారు
Good afternoon, one and all. Myself Vaishnavi from third year, and I am here to talk about kill cancer. So first, let us talk about what is cancer. So cancer is one of the leading disease which causes the abnormal growth, which causes the uncontrolled growth of abnormal cells in the body, which also spreads from one part of the body to other part of the body, and it infiltrates the normal cells and destroys the normal body tissue. So this is what is cancer. And we all know cancer spreads from one part of the body to other part of the body with a process known as metastasis. So what causes cancer? Like, how do you say these are the specified reasons? So you have been affected by cancer is nothing but gene mutations. The DNA, we all know the DNA inside our cells is organized into set of genomes, and these genomes have specified cellular functions. They guide each one of our cell to do specified functions. When there are genetic mutations, these genomes will have abnormality guidelines towards abnormal cell growth, uncontrolled cell growth, and prolonged cell death. Apoptosis and metastasis are the process. And we also have this gene repairing system in the body. Due to these mutations in the body, there is no repair of the genes in the body. These are the causes for cancer in the body. So till date, no scientist can precisely talk about curing cancer. Why no scientist can precisely talk about curing cancer is nothing but cancer is not just one disease. It is a summation of more than 200 distinct diseases. It is usually each tumor cells has specified mutations in it. If a drug, anti-cancer drug, can treat the mutation of one particular tumor of one particular patient, it is not sure that it will be treating the tumor of other patient. And these gene mutations, they keep on changing per time to time. So this is what the reason. Till date, no scientist can precisely talk about curing the cancer. So before killing cancer, we all know prevention is better than cure. How do you prevent from being affected by cancer is nothing but quit smoking. As we know, carbon monoxide is like nicotine and carbon monoxide when usually enters into the body, they causes cancer while smoking. And the next thing is consumption of alcohol. The next thing is exposure to the sunburns. And the next thing is using of radiations and carcinogens in the body. So we'll be preventing cancer. So what are the diagnosis and treatment for cancer? In the diagnosis, cancer screening is one of the most important thing in the cancer diagnosis. That is nothing but physical examination, laboratory test, CT, PET are some of the diagnostic tests usually for the cancer treatment. And next is how do you treat your cancer? What are the stages involved in cancer treatment? And nothing but primary treatment, adjuvant treatment, and palliative treatment. In this treatment, there are immunotherapy, chemotherapy, radiation therapy, and hormone therapies. These are the various methods to treat cancer. Apart from treating cancer, preventing cancer, and diagnosing cancer, what can one do? Like how you can prevent or how you can cure yourself is nothing but healthy dietary food. By taking healthy dietary food, like there are 7 rich components. The WHO has stated these 7 rich components of food that everyone has to take so as to prevent the cancer. They're nothing but broccoli, greeny leaf, legumes, and spinach, greeny leaf, legumes, broccoli, and then carrots, tomatoes. Each one of the food component that we will take has these properties so as to prevent the cancer. Like greeny leaf vegetables, when you consume greeny leaf vegetables, it is used to protect the DNA. And broccoli, it is used to prevent the normal cell growth of cells, like normal cells. And tomatoes, it is used to prevent from radiations in the skin. So all these dietary food components has to be taken for the one person. Apart from this, I can now tell that it is the in the history of cancer treatment and diagnosis. Recently the patients who have been treated in the clinical trials, they have been diagnosed by rectal cancer. They use this drug. They use a drug called dostarlimab, so which is an antioxidant that is used for patients in the clinical trials. So where the rectal cancer is being diagnosed. And the other thing is, I'm glad to tell about a college is having CMCR, I mean Center for Molecular and Cancer Research, where our college itself will be developing the artificial cell lines. Cell lines are nothing but these are immortal cell lines. Immortal cell lines, which are the modules for studying of the cancer biology, drug efficacy, and their genetic variations. Thank you. So I hereby want to conclude that it is easy for us to cure cancer and we can fight against cancer. First, all of us need is to kill the fear inside us before killing the cancer. Thank you, ma'am.
Right. Thank you. Now I would like to call J. Ruchita from third year.